Hello, my name is Dr. Dewan S. Raja. Today I will discuss about blood supply of the small intestine. I'll discuss about the arterial supply, venous drainage, as well as the lymphatic drainage of the small intestine. Small intestine, we know the parts of small intestine, the duodenum, jejunum, and ileum. The blood supply of the small intestine is primarily provided by the branches of the superior mesenteric artery, which arises from the abdominal aorta. Upper part of the duodenum up to the opening of the hepatopancreatic duct is getting blood supply from the celiac trunk branches like that of the gastroduodenal artery, superior pancreaticoduodenal artery, but rest of the small intestine, including the part of the duodenum below the hepatopancreatic duct opening, is supplied by branches of the superior mesenteric artery. Arterial supply of the duodenum. Duodenum is supplied by the gastroduodenal artery. It is a branch of the common hepatic artery. It is also supplied by superior pancreaticoduodenal artery. That is a branch of gastroduodenal artery. It often has two branches, anterior and posterior branch, and also inferior pancreaticoduodenal artery. This is a branch of superior mesenteric artery, and this inferior pancreaticoduodenal artery has also anterior and posterior branch that anastomose with that of the anterior posterior branch of the superior pancreaticoduodenal artery. Gastroduodenal artery is a branch of common hepatic artery. Superior pancreaticoduodenal artery is a branch of the gastroduodenal artery. Inferior pancreaticoduodenal artery is a branch of the superior mesenteric artery. Blood supply of the jejunum and ileum. These are done by jejunal and ileal arteries, branches of superior mesenteric artery. These are branches of superior mesenteric artery that supplies the jejunum and ileum, forming arcades of blood vessel in the mesentery and vasa recta, that is also seen in the mesentery. We call it straight arteries to ensure rich blood supply. Ileocholic artery has contribution to the terminal part of the ileum. Ileocholic artery also supplies the cecum and appendix. These two are part of large intestine. But ileocholic artery supplies a part of the terminal ileum too. Okay. So if you look at the artery, this is the duodenum. We have the superior pancreaticoduodenal artery, anterior posterior branch. There is a branch of gastroduodenal artery. That is a branch of the common hepatic artery. Here, this is superior mesenteric artery. This is the inferior pancreaticoduodenal artery. It has anterior posterior branches. And if you go here, this is the superior mesenteric artery. We are seeing a lot of jejunal and ileal branches here. They make vascular arcades. From the vascular arcades, we'll get vasa recta, straight arteries, vasa recta. And the superior mesenteric artery is accompanied by the superior mesenteric vein here. It also receives blood from jejunum ileum by jejunal and ileal veins. That is also vascular arcade and also the straight veins. Okay, in this image we are seeing these are the jejunal ileal veins. They ultimately open into the superior mesenteric vein that unite with the splenic vein to form the portal vein that goes to the liver for detoxification. This is superior mesenteric artery, and superior mesenteric artery supplies jejunal ileal branches to supply the jejunum and ileum. Jejunum and ileum has been taken out from this place. Okay. Venous drainage and lymphatic drainage of the small intestine. Venous drainage we discuss. by the superior mesenteric vein. Veins of the small intestine drain to the superior mesenteric vein, which eventually joins the splenic vein to form hepatic portal vein. This portal venous system directs blood from the intestine to the liver for processing, means detoxification and metabolism. Lymphatic drainage, the lymph from the small intestine drains into mesenteric lymph nodes, eventually enters the cisterna chyli and thoracic duct. And we know that thoracic duct enters the thorax through the aortic opening of the diaphragm, passes through the posterior mediastinum, superior mediastinum to the neck of the to the root of the neck in the left side. It crosses the posterior mediastinum to the superior mediastinum around the level of T4, T5, but the thoracic duct eventually opens at the junction between the left internal jugular vein and left subclavian vein. Okay, so these are the lymph node. Related to the jejunum ileum, we have juxta-intestinal lymph node, then we have mesenteric lymph node that will eventually go to the superior mesenteric lymph node, then ultimately it will go to the cisterna chyli, then thoracic duct. Thoracic duct enters the thorax initially on the right side, then eventually it goes to the left side and opens the junction between the left internal jugular vein, left subclavian vein. And this is a cisterna chyli. The thoracic duct begins from here. Okay, lymphatic drainage of the small intestine. If you go there, duodenum, lymphatics follow the artery, drains into pancreaticoduodenal lymph nodes, pyloric lymph nodes, superior mesenteric lymph nodes. Okay. Jejunum and ileum, lymphatics from jejunum and ileum drains into the juxta-intestinal lymph node located close to the intestinal wall. Mesenteric lymph nodes scattered among the arterial arcades. Superior central nodes located along the proximal part of the superior mesenteric artery. Upper part of the duodenum, some lymph also goes to the celiac group of lymph node, but eventually all of them should end up in the cisterna chyli, then to the thoracic duct. And that's all about the arterial supply, venous drainage, and lymphatic drainage of the small intestine. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.